my supervisor, Mila. Thank you for introducing me, Mila. I'm really excited to work for DuPage County Health Department, excited to review and discover the new gaps in our community, and excited to fill those gaps as well. I believe that each of us have a part living in in our own communities to keep our counties happy and healthy. So I'm just excited to be a part of something that actually is taking an initiative to do something like that. So thank you for having me.
Thanks for coming. It's very good to have you here.
Thank you.
I want to just confirm that there's not someone else yet who's new that we haven't introduced. And if not, I want to invite Adam to the microphone to provide a COVID-19 update.
Sure. Hi. Yeah. Thanks, Dave. I appreciate the opportunity. Can you guys all hear me okay?
Mm-hmm.
Okay. I am going to share my screen. I've got a few slides. I will need help making sure it's presenter view and all of that fun. So let me know if and when you can see that.
Looks perfect.
Okay. Many of you are familiar with, I think, the format for this update. I trimmed the slides a little so you get a little bit less, I think, than maybe you typically get from Mr. Hoff. But I think I have some of the essential stuff for you here today. And I'm excited to share where we're at in DuPage County, the collective effort of DuPage County's vaccination rollout, which includes all of you, as well as our healthcare systems and our local elected officials and our police and fire and our mayors and managers. Like, it's been a really, really great collective, awesome group working together to push this vaccine rollout forward. Setting the bar, we have 789,000 individuals in DuPage County who are eligible to receive the vaccine. As of a couple days ago, June 15th, we had 532,000 having had at least one dose and 497,000 fully vaccinated. And you can see that percentage is good for 61%. I will say I did check this actually, since these slides are about 2 days behind, I did check this last night, and this number is actually 64% as of yesterday. So 64% of eligible DuPage County residents have been fully vaccinated against COVID-19, marching towards our goal of 80%. You can see that there's a few different baselines and denominators that are used for measuring this. So I've been talking about the eligible population of the overall population, which is important to consider for sort of the level of immunity in the county. Even though there's individuals who are not yet eligible to be vaccinated, it's important to see the progress there as well. And so we are now creeping towards 54% of all residents, regardless of eligibility, being fully vaccinated. And we were the first county in the state to break 50%. This week, we were also very excited and proud of our clinic at the fairgrounds, which administered its 100,000th dose this week. So our team was very excited. They've worked hard, and it was nice to be able to acknowledge that milestone for them. As a county, all of our providers and all of our residents together have done their part to access 1 million doses being provided to DuPage County residents. And we hit that milestone last. So again, it's really this collective effort of providers and residents and all of you kind of doing our part to get this vaccine into everybody's arms and make it accessible. You can see in the week that went from June 8th to June 15th here, just that we're still doing a lot. It's slowed down. That is absolutely the case. The rate has slowed down. There's less demand, but you can still see, in that most recent week of our measurement, there was 32,000 doses administered. 21,000 of them were people getting their second dose and becoming fully immunized. So it was another 2.3% increase over that week. So slowing, but still growing. And here you can see that the comparisons of just kind of how we rank. So we've always been measuring ourselves more on the left, kind of in the Chicago metro region, we would think that is a good comparative lens, considering population sizes are more similar in that group. And then on the right, you kind of just look at us compared to all counties. So again, that collective effort of everybody in DuPage really leading the charge in Illinois. This is a slide that our CD Epi team does a deeper dive, breaking down how providers in DuPage County that are providing the vaccine, the details of that, who they're reaching. And I don't know, Dr. Chug, if you're on and maybe you want to highlight anything, any updates on this slide?
Sure. Thank you, Adam. Yes. So we've tried to highlight any recent changes in the past week in red font. So you'll see starting at the top left that our number of vaccination sites continues to grow. Certainly not by the leaps and bounds we were seeing in the initial weeks and months, but still encouraging that we are still having COVID-19 vaccine providers apply and be approved, so that we have expanded access in our community. So that increased by 5 in the past week. And then as we see in the 2 columns for first dose and second dose administration, initially broken down by race, that we're still seeing some incremental progress and increases, even if it's 0.1% in our Asian and Black population for first doses. And then second dose also a little bit of an increase. And then by ethnicity, in the past week, we saw an increase of 0.2% for our Hispanic community members and in the first and second dose administration. And then in our age group with recent expansion, it's just been about a month since the vaccine eligibility for 12 to 15-year-olds was added. And so we're fortunately seeing an increase every week in the less than 16-year-olds going up. And then by sex, we've been observing this concerning disparity where the female to male ratio has been about 55% to 45%. And we want to make sure, as you can see, our residents are 51 to 49 female to male. So want to make sure that we're reaching out to our male population who, we know at least initially that many of the priority groups in phase 1A, phase 1B were disproportionately female, either by occupation or by long-term care facility resident status. But we want to make sure that we're, again, equitably reaching everybody. And then if we look at our county of residence of persons vaccinated at DuPage County vaccination sites, we're seeing a little bit of increase in those who reside in DuPage County, approaching 60%. So those are the most recent data that we have from iCare. Thanks.
Thank you, Rashmi. I think it's always interesting too, especially that county of residence for me, because I know for a long time it was a lot of stories of DuPage residents having to travel outside DuPage to get their shots. And, it's of course, we've seen at least 40% of the opposite of that, of folks coming into DuPage to get shots as well. So that was never a very clear line with that. Moving on to one of, if not the most vulnerable groups, and so was, of course, a top priority for DuPage County to vaccinate is 65 and older. You can see that over 90% have received at least 1 dose as of earlier this week, and 88% are fully vaccinated. That has typically been good for top two or three in the state at any given time in terms of the rates of vaccinating individuals 65 years and older. The newest group of eligibility of the 12 to 17-year-olds, you can see some of the progress here. So I think it's only been a little over a month since 12 to 17-year-olds became eligible. And you can see that 49% have received at least 1 dose as of this week, and 30% are already fully vaccinated. So I think that's been pretty good progress. Of course, they came into eligibility at a time when access was pretty widespread. So it was probably fairly easy for those parents who wanted to get their children in to do so. But it seems like it's been a fairly good uptake so far. So that, vaccination, that's the local lens on vaccination and the progress we're making there together. As you know, vaccination is directly correlated with the case rates, hospitalizations, deaths, the disease activity and outcomes. And so those are then correlated with the state's reopening. I'm sure you are all aware, 1 week ago today, we moved to phase 5 of the statewide reopening plan under the governor. That was, we were able to do that based on these metrics all trending in a very positive direction. So overall, you're seeing all of those thresholds being met, ICU bed availability, new hospital admissions decreasing, hospitalized patients decreasing, and mortality decreasing. So we should all, I think, sort of pause and reflect and be really happy about these trends. So however hard it has been with all of this and with the vaccination rollout, we're seeing this light at the end of the tunnel here, and that means that is a reduction in cases and hospitalization. For those that are interested in reading more specifics about phase 5 guidance for certain settings, that information is available either at IDPH's website or on illinois.gov under the governor's website for Restore Illinois. You can find all of those details. This is just a reminder that we do have over 250 vaccine providers that are enrolled and eligible in DuPage County to deliver a COVID vaccine, and that, sort of that breakdown. I don't think that breakdown is totally up to date. It doesn't add up discretely, but the takeaway message there is lots of pharmacies, lots of medical practices, lots of opportunities and settings in DuPage County to be vaccinated. Very importantly here, this is new, and I want to make sure we're really getting the word out about this. As we've seen decreased demand across the county, we've seen huge decrease at our fairground site. We're still there 6 days a week, but that's as of this week. So starting next week, we are going down to 3 days a week, as you will see. So this is our last full week there. And then starting next week, we're doing a Thursday, Friday, Saturday model for the foreseeable future. We've got this planned out for the next 30 days. We'll reassess again where we go after that. But the demand has dropped off significantly. So our location at the fairgrounds is consolidating. We decided to keep the Thursday, Friday, Saturday days based on having some variability in access. So Thursdays we're able to be there into the early evening, and of course still continuing a weekend day. These surprisingly have been the days that we've seen be the busiest. We've seen the Thursdays and Saturdays be the busiest. Maybe that's not surprising, but I didn't know what to expect, and so that is what we're going with now. So this takes effect next week. And you can see the hours stay the same for next week, but then they start to shrink a little bit in the subsequent weeks as well. So we'll be there in the early evenings on Thursdays, but only from 3 to 7. Saturdays, Fridays close early and Saturdays stay the same. So this is on our website. We've done social media about it. We will do more. There will probably be a press release about it. Again, it was embedded in a press release earlier this week. We'll probably do a press release to feature this specifically and do another round of social media. So if you guys can help get the word out, that's really appreciated. We certainly don't want people showing up on days when we're closed and being discouraged by that. This is, a reminder that the health department is coordinating a program for those who may need homebound vaccinations. I can share with you, we've done 147 of these homebound vaccinations so far, and it's been a wonderful partnership with EMS. They've done 101 of those, and our staff have done 46 of those. And we've also connected to other groups that are providing homebound vaccinations. We are happy to serve as a central hub for anybody to register with us, and then we know that they are in need, and we will connect them with a resource. So that registration information is the same. It's on our website. It's still open. People can register for vaccination. We check that at least weekly. Okay, there's somebody out there who still, is interested in a homebound vaccination, and we can coordinate to make that happen for folks ongoingly. So there's a little bit more detail here on the homebound, but also wanted to highlight on the right-hand side, sort of our mobile efforts. So far, we opened the request form for people who are interested in mobile events on May 5th. We've had 49 requests since. 29 of those have been completed, 12 more are scheduled, and there's a few that have either ended up being canceled because there was not actually enough interest, which honestly the bar is pretty low for that. Events have only been canceled when there's only like 1 or 2 signups, but if there's at least 5 or 10 people, we're doing it. And so for the most part, requests have been successful. We will either match to a provider who's a good fit for that specific scenario or the vaccine of interest, or it will be something that the health department can do themselves. So it kind of depends on the nature of the request, but we're keeping that form live and open and still accepting requests every day. And then this is another really important slide I hope you take away from today. To me, this just speaks to how truly effective the vaccines are. They have probably worked better than we could have imagined. And I think that the rates you see here show that. I will pause though. Dr. Chuk, do you want to comment on this data in those slides?
Sure, thanks, Adam. So yes, as Adam mentioned, these are, this table reflects data of our cases in DuPage County, of COVID-19 cases by severity, our overall cases, as well as our hospitalized cases and our deceased cases since mid-December, when vaccine was first authorized for use in the United States, including in DuPage County. And as many of you on the call know, we didn't actually receive vaccine in DuPage County till the 16th, and it was distributed and administration started on the 17th, and then it's only increased from there. But we thought that was a fair point to begin our tracking. And as you'll see, and let me draw your attention please to the red font content at the top, that of the 36,000 plus cases reported since December 15th in DuPage County, we have 0.6% vaccine breakthrough cases. So basically cases that were reported in fully vaccinated persons. And so that leaves the balance of 99.4% of cases occurring in persons who are not fully vaccinated. Then if you look further down, there's in the second bullet, we have an even small, like a tenth of that. So 0.06% of cases were among fully vaccinated persons. So again, the balance of that, both like over 99% of case activity and severe outcomes are occurring in persons not fully vaccinated. And then tragically, we had 6 cases who were in individuals who had been fully vaccinated who died related to COVID-19 complications. Again, tragic at any level. And at least it just shows the vast majority of deaths related to COVID-19 are occurring in those who are not fully vaccinated. And just for a little bit more detail of the 6 deaths that we saw, if you see in the bottom row there, our total deceased cases since December 15th are 287. And then 281 of those are in persons who were not fully vaccinated. And then the right column shows the 6 who were fully vaccinated, excuse me, and 5 of those 6 were in persons 60 years or older. And all 6 individuals had underlying medical conditions, including including immune suppression, which, as we're learning, can result in some fully vaccinated persons not mounting a full immune response, similar to others who have who are immunocompetent. So, or basically who who are not immune compromised and are able to mount a more optimal response and protection. So all the more reason why we need to bring down the overall community transmission level by everyone getting vaccinated who can and who is eligible, so that we have less exposure risk to those who either aren't eligible for vaccination yet or who haven't mounted a full immune response, because all of these cases occurred in recent months where virus transmission levels were still quite high. So, but yes, basically the takeaway, as Adam was saying, is we're so fortunate to have, such a safe and highly effective tool in the vaccines. And COVID-19 has largely transitioned to being a vaccine preventable disease. Such a tragedy to continue to have any deaths and hospitalizations occur, because these are largely preventable by vaccination. So as we've been saying, anyone who's eligible and not yet fully vaccinated should run, not walk, to get vaccinated. These vaccines are saving lives. They could save, they'll continue to save lives. For anyone who's not vaccinated, they could save your life. They would say they help to protect those in your household and friends, family, coworkers, and just the community at large. It's just really, really helping to create a healthier and safer community for us all. Thanks, Adam.
Yeah, no, thank you, Rashmi. I think, we were all excited in the fall, in late fall and early winter, when it was, the headlines were, 95% effective, right? But now this, to me, is even more powerful. We have 6 months worth of real world application, local data that shows that the vaccines are working. So appreciate your team putting the data together and you walking us through it. Just a few more things that I'll be very, very quick with. And some of this stuff you've seen before, but I do think is important reminders of all of the materials that are ready, ready to use. You can pull them down free from our website, push them out to your networks, help educate on all the facts associated with COVID-19 and the vaccine. So here's just like kind of what that web page looks like, where there's a lot of different materials that you can pull from. And kudos to this group, of course, that has helped develop these PSAs that are a wonderful tool for inspiring confidence and educating on the vaccines. I think it's really, video is such a rich and strong medium to deliver this message. And so these are also available on our YouTube channel that you can plug and play as needed. And thank you to members of this group who have helped make that possible. And then I just did keep in a couple slides that are 2 questions I think that we've heard the most recently, about the natural immunity versus the immunity of the vaccine. And I think that, what's important there is really that second bullet, is that it's not worth rolling the dice to maybe get severe illness and have significant health outcomes, negative health outcomes, to achieve natural immunity when you can get the safe immunity from the vaccine. We also understand the immunity from the vaccine a little bit better. It's been studied a little bit more closely, and that it is high levels of protection, whereas natural immunity is still pretty mysterious and not well understood. So it's just certainly not worth the risk of saying, well, I'll just see what happens with natural immunity, because it's really a roll of the dice that is just not necessary at this point. And then the second one is really a question, again, that we hear a lot on fertility. And you can see here that these are, at this point, considered safe and effective for pregnant persons, not having any negative impact on fertility. I don't want to get too far above my sort of pay grade here, though. So Dr. Chug, I might ask you to weigh in on this question a little bit.
Sure.
As well, if you don't mind.
Absolutely, yeah, and you covered it, that these are that tens of thousands of pregnant women have been vaccinated already, and their close safety monitoring continues. There are weekly reports that are issued, and so far there are thankfully no safety signal, meaning no abnormal outcome or reason for concern or, precaution or anything to be issued. Pregnant women or even, or definitely women of childbearing age should absolutely proceed with vaccination. And now what we're finding in studies are that not only does it help prevent COVID-related complications in pregnant women, but in women who are lactating or breastfeeding, that there does seem to be some protection conferred to the newborn as well. So really all around, there are many reasons for women who are either thinking about pregnancy or just women of childbearing age. There's a lot of misinformation and disinformation, unfortunately, that has been widely disseminated, on social media and other forums. And it's just unfortunate because it's a missed opportunity, or it's influencing negatively, people from getting vaccinated. And we just really need to get the word out there to correct that information and help positively inform and influence their decision, because a lot of that disinformation is about it'll affect your DNA, and that is absolutely not true. None of the vaccines mix with or interact with our DNA. There's no persistence of the vaccine materials. There are no adjuvants or preservatives, which is why the vaccines need to be used within hours of a vial being opened. And there's no chance of getting COVID-19 infection from the vaccines. And again, no risk of miscarriage, no safety signals related to the vaccine administration in tens of thousands of pregnant women being vaccinated so far. What we do know is that COVID-19 illness and complications in pregnancy are increased versus so some people who are not vaccinated, who are getting COVID-19, who are pregnant, are experiencing a higher incidence of complications, including preterm birth, maternal hospitalization, ICU admission, and tragically death. And that's exactly what we want to prevent and what we can prevent through vaccination. Thanks, Adam.
Yeah, thank you. Okay, so that is, I think, everything I have today. We certainly can and will make slides available to everybody. There's certainly information you can have, and I'm glad for you to share it. I've got just under 5 minutes. I can stick around for questions now, but certainly Mila and Dave and Kara and everybody, you know how to track me down if I can help offline, but I can hang around for just a little under 5 more minutes.
I was wondering, I remember we talked about in a previous meeting that the work was being done to compare vaccination and disease with the census tracts. Is that publicly available information? If so, where can it be found?
Yeah, great question. We are still working on it. We're working with the state on access to that information. It is not yet available. We are told we're very, very close to that. We've seen some preliminary glimpses of that data, but it seems that it is not ready even for our consumption, let alone public consumption yet. So great question, and I would keep asking it until we can get it.
Thank you.
Similar question for Adam, Rashmi, Mila, and others. Is there any more information coming from the state in regards to the unknown data gaps that we have on the race and ethnicity data about when we might hope to see some clarity in those gaps?
Rashmi, do you want to?
Yeah, I can start. And so great question. And I think we're optimistic that a lot of that will be addressed when the census tract data are kind of vetted and released also, because they've provided a lot of that kind of behind the scenes matching. And our understanding, at least from what we've seen, is that there is a lower percent of unknown status, but it's just the quality and accuracy of the data based, I think, on their methodology. We actually have a call next week to try to understand and address our concerns a little bit more with the state. But so as far as the race and ethnicity status of of vaccinated persons, that should be improved. It's just the accurate calculation of rates by census tract that we're working on, so that what we do report out, like Adam was saying, so we all have more confidence in it. Thank you.
I have some concern, David and Adam, on this data. So I'm looking at the chart which Adam shared. Can you hear me?
Yes.
Yeah, okay. So one is, it is saying Asian, Black, White, and Hispanic. And we have no information of even Arabs. I've been talking about Arabs, have Somali, Sudani, Syrian, even Arabs are not, like generally that whole category is not there. I'm very concerned.
I would share in your concern, and I wish I had some kind of answer for you on that. I think that there is significant flaws with the way that we collect data to represent all groups, from the top down, from the census on down, and then you have variations in how each provider collects data and which of those fields are used. They are significantly limited. I don't have an answer other than to say I agree with you and I share those concerns. I don't know if others, Dr. Chu or anybody, Kara.
Well, I know that it follows I know that this is a political issue. It shouldn't be, but it appears to be. And I know that the prior administration made the decision with the census to not change the racial and ethnic designations. And it brings to mind for me two questions. Number one, have we been given any signals that the current administration plans to reverse that plan for subsequent data collection? And two, are we as a state in any way governed by federal decisions around how race and ethnicity are defined, or do we have the ability to make our own decisions? I know it's very difficult to do at a county level, but could we not as a state have some advocacy to try to increase the accuracy of our reporting?
No, Kara, but we used to know that how much Arab are, even that is erased completely. And I've been asking about, like, Arabs are not, we cannot even understand with the Arabs only, how many Syrians and Sudanese. Let's just talk about these two. Somali, there's Iraqi, there is like a whole huge category, and they are living in our society. They are here, we are serving them. So the whole category is gone. Like, you can remove Asians. Let's say if we don't have Hispanics here, how would we feel about it? I mean, this is not correct.
I think there's agreement. I think our question is, what can we do at our level? Like, let's figure out what we can be doing, both from an advocacy standpoint to try to change that trajectory on a state or national level, but that can be a frustrating process. What could we be doing locally that would give us some agency over this? Because I agree with you, Dr. Asfar, at the DuPage Health Coalition, we include racial designations that are not included in the US Census in our tracking, because not having that information is worse to us than having our data not align with the US Census. I care less about that piece, frankly, than I do knowing more about the families that we serve. And I'm just wondering whether we, as not just as members of HEART, but with influence amongst our other community partners, could be working to make changes at the local level, so that at minimum, we would have a better sense of what was happening in our backyard. Because you're right, it's a massive gap, and we have reason to believe that we have challenges to health equity in this space, but we're guessing because we don't have data. We can't confirm our concern.
Dr. Asfar?
I'm sitting here because I believe in this group, and we really, the next portion will highlight that how much trust and sense of community this group brought. But we really need to talk to our county representatives, and they have to stand up and speak and reach out, and because we are the number one county. We are the number one county in whole Illinois, and we have a say in the state. I'm I cannot accept that that we don't have a say and we cannot speak up and we cannot raise our voice as a team. We have to. This is not acceptable.
Dr. Asfar, this is Rashmi. I completely agree. And I think it is absolutely an opportunity, as Kara was saying, for us to advocate at a local, state, and federal level. And I think the more we can inform more specifically what our requests are, I think that I imagine that we'll have a very compelling case for what our requests are. So I think we just need to strategize and determine specifically what our requests are, because as Kara was mentioning, there have been some unfortunate decisions made at higher levels than us, you know, at a national level, which I think need to be corrected and improved. But we also can't wait for those. And we do, like the DuPage Health Coalition is doing in other sectors, to make sure we're tracking as equitably as possible and reflecting accurately our community composition, so we can help, you know, again, strategize and target our outreach accordingly. And Dr. Asfar, you mentioned that a category was gone. We've never had data reflecting vaccination data or COVID-19 data, for that matter, among Arab Americans yet. But we definitely, I think we need to explore that further. And I think, Dave, you had shared some resources recently that could help us begin those advocacy efforts. But I do think this network, this coalition, will be an excellent forum for us to be able to do that. And Dr. Asfar, I think we will definitely need your input and expertise in helping to inform our efforts at a local, state, and federal level.
Yeah, I will share this again with folks. I don't have it available to me now to drop in the chat, but COVID has raised up this risk issue for Arabs and Arab Americans. There has been data available for us to track race and ethnicity in other ways, but there's lots of good reasons to believe that Arab Americans have been more at risk during the pandemic, but we just don't have data. There is some good thinking about this, and the one recommendation that came out of this paper that I shared at our last meeting was for local providers to embrace this. There is the long-term issue of getting this dealt with at the national and the census level, but as Kara's mentioning with DuPage Health Coalition, there are ways for us to do this on the supply side, so that as local providers of healthcare who want to do the best for our constituents and patients, and DuPage Health Coalition is the great example there. We know we benefit when we do that. We know our community is healthier and safer when we do that. So I hope that we will take this particular issue, as we are a lead county and as we do have a significant Arab and Arab American population, that we'll begin this conversation with our local providers regarding what's the benefit to you to collect this information, and how could we do this in a way that is coordinated and will prepare us not just for COVID recovery, but for the next issues that will arise in the future. It's a really important point, Dr. Asfar.
You know, David, it's one of those, another one of those examples of why normal was not good and what's not working. And we now understand more clearly the changes that we need to make as a society. The OMB, if my memory serves me correctly, Office of Management and whatever it was, put those 5 categories in place. I think it was way back in the 1980s, and why that has not changed since then just makes no sense. But to Kara's point, why we cannot require our providers to ask for more specific identification of people they serve seems to me to just be logical that they would give us this information if we are requesting it, until those changes come down from the federal level. And from what I recall about that, the reason that that has stayed in place is directly linked to funding, how the federal government funds various program. So that change may not come anytime too soon, but in the meantime, it just seems to me, again, not to be redundant, that we should be able to call upon our providers to say, this is vital information for our community, for the DuPage community, and require that they provide that. Is that unreasonable?
Kara, do you think we could require it, or maybe we could give them a format and make suggestions on how they could incorporate that data collection into what they're doing?
To be honest, I don't hear a tremendous amount of resistance. It is more that I think people need assistance, support, and encouragement. So ultimately, if we found that we were not making strides, that we, it's kind of the equivalent of enrolling first and cajoling second and requiring third, only if the others don't work. But I'm curious, Mary, if you know, and you may not, I mean, are you guys under any obligation at the county government level to observe the same designations that are used federally, or do we have the freedom to make different choices? And one of the things I'll say is that I think that funders can be incredibly powerful when you're trying to encourage a change. So if United Way consistently asked each of us who are United Way funded to report on data that we're unable to report because we don't collect it that way, that becomes a compelling incentive to think about making some changes to it. But I don't think that's the only one. I just think it's one of the ways we could approach it.
I just want to share, being a vaccine provider, and as I entered, this data into iCare, I know there is actually, a place there where different ethnicity is identified. It's not enough, but there's representation which does not really reflect, what's in the data right now. Because I did it myself in entering into iCare, but there certainly is a room, for improvement there. But I think there has to be, more education, to the community. This might be a good, place. iHeart, is being number one in the state. More education to the different organizations, because I myself was kind of hesitant, like, is this okay to ask? And it's not in the very first encounter with a patient or with an employee where you ask their ethnicity. So I think there needs to be more education, because it's not stated, like in the consent forms. It's only when I entered those data that it was actually addressing different ethnicity. But it can be expanded. There is, room there for a lot of improvement.
Yeah, to answer Kara's question, I think that certainly we are, if the state or federal government require us to collect data, we have to collect that data. I don't think that there's anything that says we couldn't request data beyond what we're required to collect. I think the pushback you might get from various types of providers would be that their data collection systems are designed to follow the state and federal regulations. And so and you have to do that in order for data to be able to be aggregated up to the next level. So if DuPage County's data didn't include everything that's currently required, our data wouldn't be able to be aggregated into the state or federal system. I don't think there's anything that says we couldn't request. Now, whether we could require additional data, that I don't know. But I think, for example, our homeless management information system, all the demographics in there, all those data points are based on the requirements of the federal guidelines that we operate under. So we would have to modify our data collection system to have additional questions.
Problem that you have when you have, for example, a Middle East, North African option is that then when you are taking your data and translating it, for example, to a funder or another data collector that doesn't have that category, is you have to decide where to put that in their categories, which we all know doesn't fit. So, it's equally problematic, frankly. But at least then we have some information, and I would prefer that. I don't know what else to do.
Can I
It
ask,
feels like waiting for this, for the feds to make a change is an exercise in torture. Sorry.
Mila, you've made a suggestion in the chat that I know we want to engage. I want to ask a clarifying question with Glee. Did I hear correctly that you currently, as a vaccine provider, have the option to select an other box, and you have an option, did I hear you say, to specify what that other is? So it is possible that data is going into the state that is.
That is correct, but it's like, when I enter, there's like Indian, the reason why it stuck to my mind is because like, oh, I saw this person, but I was trying to just recall by memory. So when I enter the data, which is after the fact, it would be hard to recall, but it was there. And, I specifically remembered like Indian ethnicity.
So that's of all the many levers, there may be one little window there that could be walked or pushed through in the immediate. That is to encourage at the time of vaccination for or other data entry point. This might be around testing for the consumer to say, I wish to be considered Arab in this data collection, and that will set the stage for the data receiver to select a category to find a place for Arab, and presumably that's going to make its way into a database in the state, and we would then have the option to say we would like this disaggregated. We'd like to see what's in the other category.
It really needs to start from the vaccine providers.
Thank you.
David, what is our position here? If we are about health equity and making all persons feel that they are included, what position do we take as a group? I don't mean to put you on the spot, but
oh no, it's quite all right. I don't. So my own thought is there's no question that we're looking for the best data. That's our life blood here. We want this data disaggregated and deconstructed. So we're going to look for solutions to do that, and we've got this wonderful, powerful group here to move that forward. And I want to note that Dr. Chug, thank you so much. You've dropped into the chat that article from NCBI regarding Arab identity and COVID-19 and steps that we can take at the local and regional level to try to pursue getting that data. And then Mila, you've made a suggestion, and I'm going to ask, well, actually, before I go to you, I want to just check Jan with you. How is that? Or would you like some more response or thought given to that question? Is it a broader question for the group?
I'm going to ask Dr. Asfar to chime in on that, because I think it's important that we hear her and respond to what she is saying.
Thank you, Jen. I think this is the time for this group to roll our sleeves and stand up for the justice. This is really, I feel, not good.
I
mean, it has to be at multiple levels, of course, with the vaccine providers for sure, but we have to come up as a heart as this group, we have to say a clear, transparent, clear voice and raise this concern with the county, and county also and at a state level. Really, we have to make some buzz, some noise that this is not correct. We are not going to accept that. That's I think we have to roll our sleeves and start working on that. because I'm sure, I'm 100% sure that this issue is in other counties, and there will be support will be there, political or non-political. This is a just cause. We cannot just shun this, that it's a political issue, this should concern us as our neighbors. And and we have these, Asma is right here, Palestinian Arab. She's sitting right here. She has been part of this group. So we have this huge community. If we are not, we have to stand up and really make some sound.
Mrs. Rashmi, I wholeheartedly agree. And I pretty confidently can say we have consensus among HEART members to absolutely support and promote and advocate for representation. Everyone must be counted. Absolutely. I think what it behooves us in our advocacy to be as specific and strategic in our approach, so that we absolutely want to make some noise. And then we want to, because then I think whoever we look to decision maker wise, then they'll likely agree with us. And then they'll look to us and say, well, what are you asking for? So we want to be as clear and accurate in the information and guidance we provide to them so they can better support us. Because I think we absolutely have consensus at the high level issue of, yes, everyone must be counted. But we want to be able to clearly, because yeah, I mean, definitely we want better data, but how do we get there? What is the education broadly, especially to the affected populations, and what are the, technically, what are the different categories that need to be added? And then who do we approach to add those? So I think there are many steps and layers that need to be addressed before we make some noise. I mean, we definitely need to advocate. I think we can always make noise. Let's do that and at least draw attention to the issue. But then I think they will look to us to better inform our efforts and how they can support us.
And that's very, very, very true. I learned that with the Senate Bill 1854. If you put it out there, whatever political leader you approach, they're going to depend on you to give them really good information to build the bill, because this may take a bill to change how Office of Management and Budget, I think I got it right that time, how willing they are to make that change. And that's really where the change needs to come. But in the meantime, going back to what Kara initially said, what options are available to us on the local level? And I'm thinking about how our schools manage to collect this data by race and ethnicity. How are they able to do it? And maybe we should look more closely at what they're doing and model that. For
Dan,
example,
are you confident that they are? I did. They are reporting on this designation?
I don't think schools or anything anywhere are actually doing that. That's why I know I'm hearing a lot of problematic, it's very complicated, it's complex, and yes, it is. And I think that's why a lot of organizations and people like us, they just shy away from it and they just leave it to the federal government. And obviously the federal government is not doing much about it. So I think that's why Dr. Saima Asghar is saying that we have to speak up, because if people are speaking up, it's not happening. But if organizations like ours right here, us sitting here, we speak up and we start advocating for it, that's going to happen. But for us to just rely on the federal government and on other entities, it's not going to happen. And it's very complex. It's very complicated because Arabs come from 22 different countries, and those countries have different races in them. You know, you have North African, you have Mid-African, you have Middle Eastern, you have some in Asia. You know, the United Arab Emirates is closer to Asia than it is to the Middle East. So that's why it's very complicated to say this is a race versus an ethnicity. and then or to say ethnicity versus a race. It's like in the middle of between being a race and an ethnicity. It's people that share the same culture or similar culture, similar language, similar behaviors, similar religion. So it's very complicated. And I know that's why I think the federal government even maybe shies away from it, but also it is a political issue because of, Israel being in the middle of the Middle East and Israelis being white. So for that reason, it is a political issue in that regard. But we can't say it's a political issue, so let's shy away from it and leave it alone. That's not going to help Arabs like me. There's a huge population of Arabs that will be under this other or unknown. And that's not fair for us to always have to choose between white, other, unknown, or Asian, or Black even. So, and we're definitely not Hispanic. Whenever I see the ethnicity Hispanic, non-Hispanic, of course, I'm going to say non-Hispanic, but that's the end of the road for me? No, that shouldn't be. I have an ethnicity. I'm an Arab. I have a race. I'm not white. I'm not Asian. I'm not Black. So what should I put? Other? All of us, if you speak to us Arabs who grew up in the 80s and 90s, we always were told to pick white. And that's how we grew up, saying that we're white, but we're not white. We have no affiliation with being white. So it's definitely not fair. It's frustrating. And I think this is a huge issue for our time now. And we need to address it because it's not going to go away. Nobody's going to work on it if we don't speak up and start working on it now on this COVID vaccine recognition and then move on forward. It's a huge issue and it needs to be addressed.
Asma, I absolutely agree. This is Rashmi. I just wanted to say that no one is shying away. We absolutely support this and want to advocate for it wholeheartedly. And I think there has been some work or proposals, at least, on creating a new category on census forms. And I think we could duplicate those efforts in other data collection efforts to add a category for people of Middle Eastern or North African or MENA descent, which would include Arab Americans. And so I was just wondering, so I think that can be part of our research effort, but are you or Dr. Asfar aware of any currently developed recommendations that we can support and get behind, or are there no currently existing recommendations that we should begin our research to develop recommendations that we can advocate for?
Have you heard of ISPU?
I'm sorry, I've not. What does that stand for?
For Social Policy and Understanding. They are working on this and they've been working on it. I believe they are working with the federal government, but like I said, if it's not multiple people, collaborating with it, I can share the link in the chat. And it's the Institute for Social Policy and Understanding. They do research about recognition for groups like Arabs and other places, other people to be recognized. And it's valuable information there. You can start with there because they've already started working on this for Muslims and Americans and Arabs to be recognized. So that's a good place to start. Instead of, you don't have to start from zero. People are already working on it. It's just a matter of us collaborating with them and, using our voice to show strength.
Absolutely. And we would certainly wish to engage your experience and expertise. So I appreciate sharing this, but I think we will all need to research and better understand. And because, we need it from from a personal experience and, lived experience perspective, we would absolutely appreciate your contribution and endorsement of what would be the appropriate recommendations. So even in identifying, so this is a helpful resource because it sounds like a credible resource for us to pursue further. But so I think, any research or recommendations that you're able to identify and share with the group would be extremely helpful.
To the extent that our goal is to have action, dialogue first and then action that follows, it seems to me that what would be helpful would be for us at the next meeting where this possible to bring forward any sort of nationally credible and recommendations that have been put together, so that we could sift through if there are competing ideas about how this can and should be done, to look at other organizations that have thoughtfully vetted those and come up with recommendations, so that we could find one would hope that we as an organization could adopt and then promote both within our networks and at the local, national, and arguably federal level. But you kind of have to have the hanger upon which to hang this. And I think until we have a concrete recommendation that we believe we could support, it becomes difficult to make practical advocacy aims. But I think a number of the people on this call are ready, willing, and able to do that once they have confidence that there is a better system that we should be using. And then we could say, okay, this is the one we are going to use. We're asking others to use it. We're asking our elected officials to adopt it. We're doing all of those things in service of the aim that I think a number of us share.
And what I'm willing to do too, because I'm going to use District 204 as an example. And this was from a meeting I attended a couple of years ago. They know that they are a minority majority community, and they know this based on data. So how are they collecting that data is now more interesting to me. And I actually met with Sally Joshi a couple of days ago, and I started a memo yesterday, Mila, David, Nicole, and Kara, about a request that she's making and other city officials in Naperville to do a student vaccine thing. And they want to use the van, the wonderful DuPage County van that's coming our way. I'll address that later, but I will talk with her because she's had at the PDAC for a few years now and ask, how have they been able to collect data that lets them know how many students they have by race and ethnicity? And I'll report back on that. Is that okay?
Yeah, I just went back to iCare, and I have to correct myself as far as like the Indian, but the languages I see, I'm looking at it right now, the languages are well represented, like with Arabic, Armenian, Hindi, all of that stuff, that's well represented. But the nationality, it only has Canada, Mexico, United States, and United States minor outlying islands. Ethnicity is Hispanic or Latino, not Hispanic or Latino or unknown. The race is American Indian or Alaska Native, Asian, Black or African American, Hispanic or Latino, Middle Eastern or North African, Native Hawaiian, other race, unknown, and white. And that's from the state level.
All right, thank you. Well, let me see if I could sum up a bit, and I apologize. For some reason, my video just froze, and now I can't get that image to show back up. So you're unfortunately going to have to look at, are you seeing a picture of me perhaps as I speak? And forgive me, I can't get the
We
live
see
video.
a picture of you, Dave.
Okay.
But you sound good.
Okay. Well, so a couple of things are going through my mind. It's almost 10:15. We've had a fantastic discussion, and I'm hearing the strong consensus that it's important for us to figure out how we advocate for and develop solutions for Arab representation in data. I'm not hearing any dissent from that thought. The question is, what's our best way to move forward? So that's a big thing we want to figure out today. Now, what we have is 15 minutes, and we have the focus groups for vaccine confidence, which are so important to us meeting our goals. So we want to be sure that we're giving Mimi some time to get input from us on that. I think I'm going to consider, I recommend that we consider this discussion that we've just had as an essential element of the roundtable discussion that we had scheduled for today regarding challenges, barriers, and opportunities. this is a key one for us, and I think it's been time well spent. So I'm going to suggest that we invite Mimi to the microphone to talk about vaccine confidence. And I'm committing that we're not going to let go of this issue of advocacy and solutions for Arab representation and data. But we don't want to let this meeting get away without Mimi's presentation.
I don't want to either, David, but I also want to make sure that we have an action step that we are moving towards for the next meeting. So could we have an agreement that for those folks who are interested in ensuring that we have some traction on this issue, that we bring forward recommendations to our next meeting of better ways to represent the race and ethnicity question on a demographic questionnaire so that we could sift through those at the next conversation?
Sure, I think that would be a really good one. What's going through my mind, and I'm about to violate my own transition here, I think it would be great to have a conversation with the folks at ISPU and a conversation with Dr. Nadia Abuelazam. That is, before we put those solutions in front of us, those folks can guide us. They can help us see the picture from start to finish. And I think it would be really good for us to get ourselves educated first. I think that will help make our solution building better, stronger, and more durable.
Well, then maybe that's the action step. I just wanted, I don't want us to end it saying, yes, it's important to us, and now we're going to move on. Like, I'd like to end it and say, okay, here's what we're going to do since it's important to us.
I would commit, how does this sound? I would commit to gathering within 2 weeks, so that will be before our next meeting, all the folks on this call who have an interest and capacity in developing this advocacy and solution. And let's see if we can do that and include that a conversation with ISPU or Dr. Abuelazam, and see if that can help give us some guidance about how to frame this when we come together next. How would that be for folks? I commit to, and we'll probably look to this. Well, we'll figure out a date. If you would, I'll send the invitation to everybody, and those who are interested will come together.
And David, I will commit to learning what 204 does to know what their population, what model they're using to understand what their population is. Because this is a heavy Arab Indian community, and they have the numbers. So how they are collecting those numbers, I think, is useful.
Absolutely. Fantastic.
I also wanted to say there's been a lot of strategies suggested as we were talking through this in terms of asking funders maybe to change the way they're doing things with this. You know, Kara, you had mentioned United Way, you know, funders were pushing for this, and that's a leverage point. If we were asking providers to do this, if we're speaking to legislators and state representatives, I just want to make sure I'm envisioning the solution will be multi-pronged, so to make sure that we're capturing all of those strategies so we have a comprehensive plan.
I agree with that. This is Rashmi. I just wanted to ask, and Dave, I appreciate you helping to coalesce interest and engagement. I'm just wondering, is there anyone who is interested and able to take the lead on this effort, particularly in organizing the information and resources that are currently out there that can help, like if someone can kind of begin to gather information and then draft recommendations for this group to review and consider taking forward, just to have some draft content. Is there anyone who can help take the lead on that?
I think David has to lead. I think this Hart has to lead this, and
well, Hart generally yes, but I mean from a technical expert. And Dr. Usfer, would you or Uzma be willing to help in convening the draft content of what our recommendations could be?
I can definitely help, but this is like it's like I'm hurting and suffering and I don't know what to do. I can try, but I think the leadership of this group has more resources. I can definitely connect some dots and be part of the effort, but I cannot lead.
Dr. Carr, I will help you put your pain in words. Is that okay with you? Okay.
Thank you.
And Dr. Chug, we'll figure that out. I really appreciate your asking, because just as with Heart and all initiatives, everybody is stretched to the limit. And without Mila being a backbone to this group, we wouldn't have the life that we do. And the question is, who will help us carry that life forward on this issue? And we have some interns with us temporarily this summer. I think I can call on them to help us out, but I want to keep the request out there and open, Dr. Chug, for an organization that says we got the staff time that will hold that list. We'll keep it current. We'll keep it up to date. But in the meantime, we'll take that at DuPage Federation in partnership with Jan, with Dr. Asfar, and others who will join us at this meeting.
And
Perfect,
David,
thank you. Go ahead, Mila.
thank you for thinking about how we could dig deeper into the interns and kind of expertise I think you've shared with Benedictine in the past. Why don't we talk about it off this, because we've got 10 minutes left now. But why don't we talk about how we could put together a technical group that could not only gather the resources, but summarize them and look at some best examples that we can bring back to the July meeting. Does that sound okay from a timetable for everyone?
Sounds good,
Yeah.
thank you.
Thanks. Let me ask, for those who do have your video on, who could stay an extra 15 minutes this morning till 10:45?
I can.
Happy
Okay.
to, Dave.
So
I can. I'll stay.
it looks like some can and some can't. I want to hand it to Mimi now. And Mimi, you'd be aware that we'll have this group till 10:30, and then some would be able to stay beyond.
Okay, I'll try and talk fast.
All right.
Well, this is timely to kind of segue off of this discussion. What we are hoping to do is building off the vaccine hesitancy survey work that we had done earlier in the spring. We have the opportunity to do about 3 focus groups to dig deeper into vaccine hesitancy and barrier issues. And what we're hoping to do is speak with people who aren't vaccinated yet, but hopefully are still considering it, and really using this as a forum to kind of discuss what some of those hesitancies and barriers might be. Our hope was to focus on some of the communities where we didn't get as much data or as clear of data as we would have liked to from the survey. So what we're proposing is a focus group with the Black and African American community, because we know that the numbers that came back from the survey were really underrepresented, and we're not confident that it truly reflects the larger population completely. We're hoping to do a Middle Eastern and Arab group, because we know, as we've all just discussed, we didn't have that census designation even in the survey. So to even capture that group specifically didn't happen as well as it should have. So we'd like to use a focus group to dig into that a little bit more. And then the third group we're hoping to do is a Latinx group. And while we got better representation on the survey with that group, we also know that it's a group that's highly impacted by COVID, and we want to make sure we're understanding all the hesitancies and barriers there. And I will just say as a caveat, if some of the discussion that we've had today maybe points us in a direction where we need to include maybe some additional questions, as we're thinking about, some of the Middle Eastern Arab, the Arab group, let us know that feedback in terms of, how data gets collected and how, health visit experiences are and things of that nature. If we want to use this as an opportunity to piggyback with that, certainly let's talk through that. We are hoping with these focus groups to look at, as I had mentioned, what are potential vaccine hesitancies that people have, particularly among those who haven't been vaccinated yet, barriers they might be facing to getting vaccinated. Maybe they want to, but they're unable to. And then really asking folks to give us advice. What are things that healthcare providers can be doing better to close these gaps? We are hoping to do these focus groups virtually, through Zoom or something like that for a few reasons. One, if we're hoping to reach out to unvaccinated folks, we don't want to be doing in-person meetings right now, just from a safety standpoint. It also gives us the opportunity to reach across the entire county without concern for, travel and time barriers and things like that. But we're also aware that technology can be a barrier for some folks. So if there's things that we can do to reduce those barriers, this would be a great place to have that discussion. We would love to partner with folks here at the table in thinking about how to reach out to people, to engage folks and help facilitate participation in focus groups so we can get that information firsthand. So that's something I would love to discuss today, is how can we partner with all of you to reach these audiences. And then kind of the last kind of point of discussion I want to bring up is particularly for the Latinx and the Middle Eastern Arab focus groups, what language do you think we should be doing them in? There's obviously some choices there, and I would love to talk through that as well. So that's my kind of drive-by overview of what we're hoping to do. I think maybe some of the biggest items to wrestle through are thoughts around technology, thoughts around how to reach out to folks and engage them. So hopefully folks want to participate, and then thinking about that language issue. So those are kind of my top 3 right now as we're talking through this. And I'm just going to pause and let people share their thoughts.
That would be the first thought. What's the immediate reaction to the whole breadth of what you've heard?
Okay, I'll
Go ahead, Jen. Sorry.
No, go ahead, Mila. Go ahead.
And just quick, I'll make it quick. Nicole, I see you're still on, and I wanted to say that because you've had so much experience with the Neighbor to Neighbor program, that the focus groups sort of, we're looking to get people that are vaccine hesitant. We want to hear from them. And I think that the first people that might respond to us are the folks that are engaged in this effort and maybe aren't on the hesitancy side. So if you have any, recommendations on how to go forward and promote and get the right folks involved, that would be really helpful. So it's more of a suggestion than a discussion, but I just wanted to engage Nicole because I saw her on.
Yeah, we could definitely do that. We would have to kind of filter the DuPage County vaccine champions. But after we do that, we could definitely send out an email to recruit individuals for sure.
And if you had knowledge of folks that you could recruit that did not get the vaccine, or I don't know if there's a way to do that.
So most of our vaccine champions did get the vaccine, but they work with a lot of populations and communities that did not get the vaccine yet. So if we're able to send out the information to the vaccine champions who work closely with those communities, I'm sure they would be able to disseminate information about the focus groups.
Thank you.
That would be great.
And I actually have a question, Mimi.
Yeah.
So
yeah.
I know you had some challenges around recruiting the African-American community in DuPage County. Did we work with schools to disseminate information around kind of the focus group or the survey when we did that?
Yeah. ROE sent it out. A number of our school districts sent it out on social media. We didn't have a lot of success with that. So, knowing that we did it didn't yield good results in our Black African-American communities though. And Jan, you can jump in here because NAACP shared it quite a bit, and then you individually engaged other partners to share it as well.
I actually reached out and sent it to some of the parent support groups, the diversity leaders. So I was surprised and disheartened that the response was so low. But if I could just chime in, I was speaking with Sally Joshi. I'm hoping I'm pronouncing her name correctly. And one of the things, because they're looking to increase their numbers of vaccinated persons by the time school starts back. And what she is, I'm reading from my notes here. So what she's recommending we do, with the help of this beautiful new van that DuPage County Health Department is taking possession of, she actually wants us to do a promotion using the children, engaging them on social media, not Facebook, because that's only for the older people these days. But if I'm just go through my notes, she's recommending that we use the van to park in school parking lots of the Title I schools. She says there are 5 Title I schools in District 204, and I believe there are 4 in District 203. Don't quote me on 203. And we're talking about junior high schools, okay? She thinks because these are schools where families can walk to the school. So her thought is, if we can use that van to go into these parking lots and say for an hour, and then the kids will hashtag where the van is going next. And, I'm not big on social media, then they would do something else with that. She believes that this would give us an advantage to get the kids involved and to get the families and their families members who have not been vaccinated. And she gave me the names of 3 groups: PACES, Pages, and PAC. And I know Success is another one. I didn't know about PACES, Pages, and PAC. They're in 204. Success is in 203. And I actually reached out to them for the last survey. But we are developing a plan, and this is way beyond my bandwidth. And again, yesterday, in response to your note, Nicole, I had begun writing to bring you, Mila, and David, and others into the planning of this, because again, I think this is something that DuPage County Health may want to take the lead on. But her thought pattern is, if we address the needs of families in those Title I schools, that will help us in our outreach to families, parents, and children. And we could, in that same mode, Mimi, get them to, recommend that they complete the survey. I'm kind of thinking off the top of my head here, but I mean, we can, just something for thought.
Jan, thank you for doing all that outreach within those 2 districts to look deeply at the Title I schools. I think, well, yes, so we would want to absolutely serve them, and I think going to them is the way to go. But just quickly, the link that Adam shared, it would be great if a consolidated request could be put into the health department for a mobile clinic, and there's a spot there to get into some detail. So that'd be one suggestion. And then 2, maybe next week, you and I and Kara and anybody else who's interested in sitting down and kind of looking at some very focused clinics that we can assure are not being duplicated by other organizations, or try to assure they're not being duplicated, so that we can get to everyone we need to get to and try to do that in the month of July. Because one of the messages we are looking to share is, if your child is going back to school, whether it be elementary school, college, sports, whatever it may be, and you'd like to see them immune by the time that happens, that clock is ticking now. And that those first couple weeks of July are really important from a 5 to 6 week out perspective for when they go back. If you've made the decision to get vaccinated, you should really do it now if you want the benefits for when, things kind of pick up. So
and that's pretty much what she said. And one of the city council members called me and said, I want you to talk to her. And initially I was like, well, let's do something for 203 because that's where I live. And he said, no, let's do it citywide. So, I mean, you're okay with a citywide thing here? Okay.
Oh, let's talk through it. So,
Okay,
I mean, because we've also talked about the leasing offices and some of the housing areas. So let's get
okay, but
look at that.
when you say mobile, is that the van or is that just going from spot to spot? What is mobile?
I think it could be the van, and there's some options there, and we have IDPH out and about as well. So, and we want to work with them and collaborate so that we're reaching everybody, and also not confusing everybody.
Okay.
It's the only way I can try to explain it, but I'm happy to talk further about it. I'll get an email out to you and Kara and some folks, and we can sit down and put our heads together.
Great.
I wonder, Julieta, so I'm going to do a quick entry here. I'm not sure I followed all of Jan's and Mila's connecting there. So I want to put that on the table. I want to be sure that Mimi, you're getting some feedback, and Julieta, I wanted to be sure to check in with you because
Yes.
do you have thoughts about this outreach and engagement with focus groups on vaccine hesitant and language?
I was gonna say recently, one of my colleagues, Gabi, made a video with I think there was a DuPage Coalition health department, I guess, and it was all in Spanish, and they were talking about these hesitancy, all this information. They did this on the YouTube channel, and well, I had shared it and everything on Facebook. It is pretty informative. And also my other colleague Cristobal and I were talking about actually doing that like a tour, like taking hopefully someday have this is it a bus or is it a van in our area and go to like maybe park at churches or in our area and see if we can get people to vaccinate and also inform them. I guess at that point, if there's hesitancy, address that. But then it would be beneficial for us if we have like literature to give them also for us in Spanish so that they have and we could talk to them about the myths and everything that's out there that could come up to tell them and eventually hopefully convince them it's time to vaccinate. Maybe some propaganda also for the kids to get vaccinated when they go back to school. They have to have their physicals and all. Do that too. Some kind of propaganda that says you need to get your physical anyways. Why not get the COVID vaccine?
Right. Julieta, as you're walking through that sharing of the Spanish language video, and I bet that's the DuPage Health Coalition partnership one.
Yes.
You mentioned it goes out on Facebook. So I have a question for you. Do you get hesitant feedback when you put that out? Do you have folks responding to you saying, I'm not sure I buy this. I'm not sure I trust this.
Yes, I do. I have gotten people saying, I'm not so sure. There was someone out in Addison that said, oh no, I'm not getting the vaccine. I go, why aren't you? Because I guess this I run into where people say I trust God, I trust God, and that's where I think that would be the one barrier that would be challenging to bring down,
Right.
because that's so strong out there. And sometimes I'm like, I tell them, you know what? Okay, so maybe God allowed these vaccines to be created. Could that be? I mean, I don't think that God made human beings not able to save people. I don't know.
Right.
I try. That's a very difficult one for me. Where I mean, I am Catholic too and everything, but sometimes I'm like, you need to not let God do everything for you. You have to do something yourself. I mean, I always say it's like parents and their kids, once they're adults, the you shouldn't rely on the parent all the time, right? There's got to be a point where you got to do some yourself, and this world has so many things going on. Why don't we allow God to take care of the most urgent things, and then we can do our little bit so he doesn't have to worry about us? I don't know, but
Right.
that, I don't know.
Well, what
That's the one I found when I shared the video. That individual said that to me, and okay, all right.
Well, it occurs to me that as those good educational videos go out, that's a natural link to potential vaccine hesitant folks, because your network will respond. And it's giving me thoughts about how to support this focus group work that Mimi is looking at. Whoever has taken a video, and whoever has taken one that's Spanish language, or we have other promotional videos out there in Chinese and other languages that have gotten traction, and the responses to them may be a good place for us to think
Yeah.
about.
It is
It's a data source in itself.
It is an effort in our community, because even I have my brother-in-law told me that his son and the daughter-in-law don't want to get the vaccine either, with these ideas and myths. And he, how do I, because he did get COVID earlier this year. Fortunately, it was just, all he had to do was isolate and it was gone. But he's like worried. I'm just worried because his son is also, he has obesity and all that. And he says, I don't know how to break through to my son, and he's got to do it.
Julia, I wonder if I could just, we've talked a little bit about that. And Dr. Chug, I see you still on. I don't know if we have this yet to share, but it feels like if we have some stories or some examples of cases where we're really seeing infection in the unvaccinated, in particular, I think some of the concern we have over males not wanting to get vaccinated or not getting vaccinated. Would you think showing some examples of, cases what do you think might make a difference in his mind?
I would hope that, like, maybe people who have gone through this could say, their experience, and that what drove them to, hopefully they drove them to get the vaccine, and that now they're to feel safe. I think people that have been through that, or those who survivors of people, so many that have lost maybe if they gave their input to their stories to tell people, you know, this isn't a game. This is life or death. If you don't do this to help yourself. You know, so many of our Latino community have lost their mom or their dad to this. And I think my colleagues know more people than I do with that. And maybe if we put together people who would tell their story, would say what happened, and that would, you know, convince those who are hesitant to, okay, I guess I gotta do this. I would hope something has to touch them.
I think the focus group messaging that Mimi might be able to summarize, and some of the things, situations you're speaking of might be the messages that we focus on for late summer and fall. So thank you.
I could try to convince my brother-in-law to talk, because he was shocked. He was scared, and the minute I told him, he's like, I'm trying to get the vaccine. And we were finally doing the events, and I said, okay, the minute we have one, I'll bring you over. He's a taxi driver, so it's difficult for him to just leave. And then he had to make sure someone else was on for his calls. And then he came out to Wheaton, the Methodist church, for the one thing we did first time. And he's like, thank you. And I will try to convince everyone. And that's when he told me about his son and the wife. They don't want to, and they have kids. So I don't know what to do. So I think I'm gonna convince him to talk to us. Maybe if he wants, we could record his story, and hopefully I'll, you know, somebody that knows close to me can say that. I figure out ways to convince his son, and because he does have the obesity problem too, so that's really concerning too.
Wow. So what's going through my mind, Julieta, is that as a vaccine promoter, you're a great collector of stories of concern and why people aren't doing it. You know, the effort you're putting into saying this is a good thing is washing back at you those people who have concerns, questions, or et cetera. And so this is an aha for me, but I'm sure for everybody else on the call, it's like, duh, of course. You are incredibly capable of speaking to what those hesitancies are, because you're hearing them from people who are close to you and you understand their context.
Yes. Well, yeah. It's sometimes I just freeze. I'm like, really? You know? But then my husband says, you know, that's gonna happen. There are always gonna be people in a family, even in a family that think so differently. So sometimes it's illogical the way you're thinking, but that's how it is. And
I think we all have those family members or close friends or people that you really, really love and respect. And those personal conversations are important, but it's how you learn. And I haven't solved them all yet either. So if I shared a little bit of what you're saying, not exactly for sure, but I've got a couple too that I think, you know, I pray and think, okay, we'll keep talking about it.
Yeah, my family and I, all of us here have been fully vaccinated, and we recently had a get together, and now Father's Day we'll be able to gather. So it's when the first, what was it? Oh, Memorial Day, we all got together, and I did a little Facebook Live. We're all here, no mask. This is what you get to do.
Every lever you can get.
I
I love it.
I just,
You could
I
do this
had,
too.
I had people challenging me before when I was trying to get the vaccine back in February, and there was a lady telling me, no, it has this mRNA chip or whatever. You're gonna feel things. So I'm like, well, duh. Every time you get a vaccine, you feel things, you know. But I she said, you better record when you get the vaccine. I said, okay, and I did both times, the first dose and the second dose, and I put it on Facebook and everything. And the first time I only got a little bump. The second time I did get a bit of a cold symptoms, but they went away in 2 days. And I was telling her what happened. You see, I didn't die. Nobody's following me, and I'm fine. So.
All right. Well, thank you. Well, appreciate your insights. For me, it was very good to have this conversation, this listening, and I appreciate that. And I want to check back with Mimi. We did not get the kind of a forum that we had hoped for today for the focus groups. Do you feel like you have something to go with?
You know what? I have something to go with. And if there's questions I still need answered, I think I know who to follow up with. So I can harass people offline.
All righty. Well, Julieta, thank you for staying on. A number of others did, but they've now dropped out. And I'm going to suggest that we come to a close and
Sounds
look
good.
forward to our next gathering on July 16th.